Your 40s are the decade of life where aging stops being subtle and starts to become structural. It's your skin, your bones, your fat pads, your muscles, your ligaments, all changing at the same time. That's why patients start to say things like, I don't look like myself anymore. I look so tired. I just need things back up here. So, what's actually happening to our faces when we turn 40? Let's start at the deepest layer. So, our bone changes. By the time we hit 40, our orbital eye sockets, they widen by about 10 to 15%, which then changes all the structure and the ligaments attached to it underneath. That's why tear trough hollows get deeper and we start to see a shift in the mid cheek. Our fat pads also change. We tend to lose a lot of our deep, youthful fat pads. Granted, we can gain superficial fat pads like the jowls, but we lose a lot of our deep, youthful fat pads, especially throughout the mid face and in the temples. And then we lose, as I mentioned, just adding on to the 30s, a lot of our collagen and elastin within our dermis. So our skin becomes thinner. It doesn't bounce back as easy. This is when lines are seen at rest and not just with movement. So one of the things that we have to help with this issue at Bijou is our Silfirm X device, which is an RF microneedling device. RF microneedling recently in the past couple of years has gotten a bad rap. There was an FDA warning that was put out because there are a lot of unqualified individuals that are performing this procedure. You can cause damage to the skin because it does involve heat. You really have to understand the depth of the skin in which you're using this device, or you can burn off those youthful fat pads that sometimes we don't want burn off. So it's just all about knowing how to use the device and going to a trained professional to get the best results. So RF microneedling is like microneedling on steroids. It's tiny little needles that we stamp into the skin, and through those needles, we transmit RF or radio frequency energy. So it's like heat going into the skin, which helps cause thermal contraction and collagen production. So we can see a nice tightening of the skin with that device. I also love one of our newest devices, the Everest, which uses monopolar RF energy, radio frequency energy. No needles go into the skin with this. It's no downtime, no pain, and it just helps cause a skin tightening, like a lifting in the skin. We can see a little bit more improvement with texture and tone with the RF microneedling versus just the monopolar RF energy that we use with Everest. But Everest is still great, no downtime, no pain treatment. If we want a little bit of skin contraction and tightening and lifting, does a beautiful job. And then we do have more invasive and more involved procedures like our ultra clear treatment, which is a fully ablative type laser. Great for kind of doing a resurfacing, helps with texture, helps with tone, tightening, everything all at once. But it does involve more downtime and care afterwards. So those are some great options that we offer here at Bijou to help shrink wrap or tighten the skin. Now that we have tightened the skin and shrink wrap the outermost layer, let's talk about what we can do to help keep our deeper layer, our bone, our structure looking more youthful. It's not just about tightening the skin, but it's also helping replace volume and structure that we've lost over the years. So there's several different things that we could use. It doesn't just have to be fillers, which fillers is an option. And fillers are made from hyaluronic acid, a synthetic based gel. We just use it in places where we lose volume. Simple as that. The next thing outside of that is Sculptra. Even if you do fillers, I'm still a huge fan of Sculptra. In our 40s, I think we should be getting one vial a year for maintenance. Sculptra is so important in helping us maintain our collagen and structure overall. This is a biostimulator. It's kind of like owning the house instead of renting. Where filler, you're renting the house. This is where you're helping grow and maintain your own tissue, your own collagen. It lasts a little bit longer than filler, and it just gives beautiful, very natural looking results. So I love reaching for a biostimulator where we can. Speaking of biostimulators, I also love Renuva as an option to help maintain this goal, to help maintain our structure, especially in the mid face. I mentioned earlier how we can lose these deep medial cheek fat pads or youthful fat pads throughout our mid face and our temple area. And we have options like Renuva, which is an alternative to fat transfers, which fat transfer is an option if you want to go the surgical route. But for those of you that don't want to go the surgical route, Renuva does a really good job at helping you grow your youthful fat pads back in a more natural way. It's very long lasting results. So as long as you don't go through a major weight loss shift or something like that, that fat, once you grow it, is yours to keep. So let's get down to the nitty gritty stuff like tone and texture. This is where you should still be having annual consultations with your provider, making sure that you're on the right skincare appropriate for your decade in life. You should be using at this point a hyaluronic acid, a vitamin C. Don't forget sunscreen, a good growth factor serum, and a retinol if it's suited for your skin. And don't forget about your quarterly facials. This makes a huge difference. Then there are things like microneedling. Microneedling is great to help with fine texture and small wrinkles and pore size because your pores tend to look bigger as you get older because we lose the elasticity in our skin. And then as far as tone goes and texture, I love BBL and our series of PRX peels. They work great. BBL unfortunately can't be used on all skin types. So with my darker skin types, I'll usually lean more towards chemical peels to help with fine texture and tonal problems. So I love things like the PRX peel or even our Perfect Derma peel that we offer. For people who can, for skin types like a 4 through a type 1, lighter skin tones, can't beat BBL. It's going to help with browns. It's going to help with reds. It's going to help with fine textural problems. So those are all things that you could do to help with the little nitty gritty stuff like tone and texture. So we'll see you in the next video where we will discuss what we should be doing in our 50s and beyond.